Hello, it's Dr. Rhonda Johnson. Today is Thursday, May 26, 2022. Today I'm discussing syphilis. You heard me say that, syphilis. Why? Because syphilis is a growing infectious disease threat. Now, when people describe monkeypox infection on the genitals, they often describe it as looking like syphilis. But we seldom talk about syphilis, but we should. Why? Because according to CDC recently released data, syphilis is increasing. In fact, between 2016 and 2020, it increased 52%. So what is syphilis anyway? It's a common STI, that means sexually transmitted infection. No, it's not a viral infection, but it's caused by a bacteria called Treponema pallidum. Now, it often doesn't show any infections symptoms at all, but it develops in stages called primary, secondary, latent, and tertiary, and each stage can have different presentations. So how do you get syphilis? You get it through direct contact with a syphilitic sore called a chancre during vaginal, anal, or oral sex. So what are the signs of syphilis in the beginning? Well, it's that painless small sore called a chancre, which can really look like a pimple with clear fluid at first. Now, the sore appears at the spot where the bacteria enters your body. Now, chancres can show up anywhere between 3 weeks and 3 months after you get the infection, and then they can get quite impressive looking. And usually, if they're on the penis or on the genitals and they're discovered, will cause someone to seek medical care. Now, the sore will heal on its own and it doesn't cause any pain. Now, is there a cure? Yes, syphilis can be treated, especially early, often with a single shot of penicillin. So what happens if it's not treated? Well, it goes on to those other stages. Now, secondary syphilis usually gives a telltale rash, which is just obvious. It covers the entire body. It can be on top of the scalp, your palms of your hands, and the soles of your feet. Now, if syphilis is not treated, folks, it can cause a lot of damage to your organs. You can end up with damage to the eye that causes blindness. You can end up with heart disease, brain disease, neurological disease, and syphilis can be life-threatening. So I have a message for pregnant women because syphilis can be passed from their mother to the baby during birth or through her placenta. This is called congenital syphilis, and it too is on the rise. The CDC says congenital syphilis cases increased by 235%. That's a lot from 2016 to 2020. And in 2021, their data shows another increase of congenital syphilis. Now, babies with syphilis can be born early, that's prematurely, or they can die in the womb, that's called stillbirth, or they can die after birth. So what are the risk factors for infection? 1, unprotected sex. 2, sex with multiple partners. 3, men who have sex with men. And 4, people who are infected with HIV, the virus that causes AIDS. So what about testing? Is there a test for syphilis? Yes, it's a blood test. It's called the RPR, Rapid Plasma Reagent Test. Now, there's no limit to how often you can be tested for syphilis, and you should get tested for syphilis regularly if you're pregnant or if you're a man who has sex with men, you have HIV infection, or you have multiple partners, or you've been sexually active with somebody who tests positive for syphilis. Now, there's no vaccine for syphilis, so prevention is the key. So watch your sexual partners, be in a monogamous relationship if possible, use a latex condom, and avoid getting high and having sex because that can alter your judgment. So in closing, untreated syphilis can have life-threatening, lifelong, severe health consequences, and congenital syphilis can cause a baby with disabilities, higher rates of stillbirth, premature birth, and infant death. That's my message today. Take care, folks, and be safe out there.